The first one is the ECG, electrocardiogram. And it's a very simple test. It's a recording of the electricity of the heart. And it's done by doctors or by nurses or technicians. And it gives a very good idea about the heart rate and the pattern of electric stimulus that goes through the heart muscle. The commonest problem that we run our ECGs to exclude is something called atrial fibrillation, which is an explanation for a patient's palpitation. The second test is chest X-ray, old-fashioned, but still very, very important. It differentiates between cardiac conditions or heart conditions and lung conditions as an explanation for patient symptoms. Third one, echocardiogram. An echocardiogram is ultrasound on the heart, and it shows the inside of the heart, the structure of each part of the heart, as well as the function of each part of the heart. It shows how the valves open and close, if there is any narrowing in one of the valves, how a valve would leak, for example, what is the cause of the leak, whether that cause is repairable or not, and so on. In addition, it shows the function of the heart muscle itself, which is very important in explaining particularly shortness of breath. What I just said now applies to the two halves of the heart, valves and the muscle function on the left half of the heart as well as those of the right side of the heart. And the pathology of the two conditions is different, the manifestations are different, so therefore echocardiography represents the cornerstone diagnostic investigation for any cardiac patient. Recently, other non-invasive investigations developed, in particular MRI, we call it CMR, cardiac magnetic resonance, and again it's not too dissimilar in principle from echo. However, it's more precise in looking at heart muscle function. It cannot estimate the pressures inside the heart like echo and Doppler do. Also, when it comes to valve disease, I would recommend echo rather than MRI because of many reasons. We can discuss them when we have time. And finally, also recently, CT scanning has become a very important investigation. Why? It can provide the extent of calcification in the coronary arteries. It provides very good knowledge about the coronary circulation itself, about the anatomy of the coronary arteries, whether they come from the right spots from the aortic root or they are anomalous, means there is congenital issue here that should explain patient's symptoms and prognosis too. So it's very important, CT, and has become, again, a conventional investigation in almost all DGH hospitals around the UK. So it's very important. Having said that, the cardiologist and the surgeon should bear in mind the potential drawbacks of each of the investigations. While echo is operator dependent, it needs very high skilled person to be able to give a solid conclusion about the condition. CT scanning involves X-ray exposure, so we can't keep repeating it. But the echo, for example, you can do it every day if you want to. MRI scanning involves placing the patient in a closed tube, which could be claustrophobic for some patients. Lots of patients do not like it because of the noise it creates. And as I mentioned early on, it has its limitations in terms of what information it provides. So it needs experienced clinicians here to decide which investigation to send his patient to.